Hey everyone, let's talk about what you need to do to get ready for your radiation treatments. So not only am I a radiation oncologist, but I am also a 9-year breast cancer survivor who has had radiation treatments. So I'm going to give you some tips and insights to help you go in more prepared and less worried about your treatments. Let's dive right in. So the first thing that you need to do to prepare for your radiation treatments is to make sure that you have great range of motion in the shoulder, in the arm on the side that's being treated. Because when you get your radiation treatments, if you're having external beam radiation treatments, they're going to ask you to lie on your back and they're going to ask you to put your arm up over your head. So you're going to be in this position for your treatment every day. So it's real important that this position is comfortable. So if you have any tightness in this area that's uncomfortable, and you're having problems getting that arm up over your head, it's going to be important that you do the exercises that the surgeon gave you to stretch out that arm so that this position isn't uncomfortable. Now, if your surgeon didn't give you any exercises, you may want to ask them to send you to physical therapy so that you can get support in stretching out this area, or make sure that you have whatever pain medication you need to take so that when you come for your treatment, you're able to get into this position comfortably. Because if you're not comfortable in this position, two things are going to happen. You're going to move during the treatment because you're not comfortable, or you're just going to suffer. So we don't want you to do either one. So it's important to handle that before you come in for your treatment so that everything flows smoothly. Okay, second thing that you're going to need to do before you start your radiation treatments is you're going to need to get a comfortable bra. Now, what I typically suggest is that you reach for that old stretched out bra that's typically in the back of the bra drawer. That bra that has stretched out over time. You haven't gotten rid of it, but you don't really wear it. Pull that bra to the front and have it ready for your radiation. I tell you to do that for two reasons. The first reason is because towards the end of the radiation treatments, that skin's going to get sensitive. It's going to get irritated. So you don't want a bra that's too tight. So a loose bra is the perfect thing for that time of your radiation. Second reason is that some places use ink or even paint markers to put marks on your skin for your treatment. And that ink or that paint marker can sometimes transfer and come off on your clothing. So if you have an old bra on, you're not going to care if you get ink or paint on that bra. Because when radiation is over, simply you can just throw that bra away and it'll be just fine. Now, if you don't have an old bra in the back of your drawer, if you're somebody good at purging and getting rid of old stuff, then just go out and buy you a sports bra, preferably one that zips in the front. One that's not too tight. You want it a little loose, but tight enough to support you, but you don't want it so tight that it's irritating your skin. That will suffice as well. Okay, the third thing that you're going to want to do is you're going to want to make sure that you develop some type of exercise routine. So if you haven't been exercising, this will be a great time to start. Now, nothing strenuous, but you do want to use a combination of cardiovascular and resistance training. But you want to create some type of exercise regimen where you can get in 150 minutes of exercise through the week. So that's typically about 30 minutes, 5 days a week of exercise. Nothing strenuous. You can do some walking, some dancing, some, even just movement, house cleaning, anything really counts. You just want to be active during your radiation treatment. Why? Because science has shown, there have been clinical trials that show that there's actually a benefit to exercising during radiation treatment. It decreases your fatigue and actually helps the radiation work better. And it's just going to help you feel better because you will have more energy. Okay, fourth thing that you want to do to get ready for your radiation treatments is you're going to want to make sure that that skin on the breast is moisturized. So that means that you need to start applying a moisturizer twice a day, every day, before you go in for your radiation treatment, because the more moisture that skin has before starting radiation, the fewer side effects you're going to have during treatment. Now, I have lots of videos where I have reviewed lots of different products for use with radiation therapy. You can choose really any of those products, whichever one that you like. They all work. To some degree, I have to do some nuances in the reviews, but pick the one that's right for you. Start using that, about 2 weeks or so before you start radiation treatments. then when you go in, let the doctor know what you're using. Sometimes they have a cream, a specific cream that they want you to use, but many times they're going to tell you to go ahead and continue using what you already have. So you'll want to go ahead and moisturize that skin on the breast before you start. The fifth thing that you're going to want to do is you just want to make sure that you've got some support during all of this. Radiation treatments are fairly easy compared to surgery or chemotherapy. If you've had that, this is really the easy portion of your treatment. But as you get towards the end of treatment, you can have some skin irritation, and the seatbelt may make riding in the car a little bit more difficult, or even driving. So you may want to have someone, on call, just in case you need them to help bring you in for your treatments. Or you may even need some help at home, but you definitely want to have some support during this time of your radiation treatments. So I hope that this was helpful. If so, please like this video, share this video with someone who you think could use this information. If you've got suggestions on things that you want me to answer questions for, put those in the comments. And I will see you guys in the next video. Take care.